Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great video on how your glute or buttock muscles relate to your multifidus stabilizing muscle of your lower back and how to integrate the two with glute weakness and delayed multifidus action to improve your lower back pain with the following corrective exercise. So many times with chronic lower back pain, regardless of its cause, whether it's disc-oriented, facet joint arthritis, stenosis, a pars defect, spondylolisthesis, we have a weakening of certain muscles. And among the most common muscles to weaken in chronic lower back pain are the buttocks or glute max and the multifidus muscle, which is a small muscle that runs from the outer lower edges of each vertebra down and out to connect to other vertebrae on our pelvis as well, and our sacrum, which is that keystone that the spine sits on. Multifidus muscle weakness allows an excess motion to happen between the vertebrae that many times causes pain because of the resultant stress that goes on the soft tissue fibers of the disc, or the joint capsule, or several ligaments, or even muscles, other muscles in the area. So multifidus weakness can be identified, or its atrophy, shrinking in size, by feeling the lower outer corners of each vertebra in your lower back. If you go to the midline bones, those knobs in your lower back known as the spinous processes, and go to the lower tip, taking one thumb on the right side and the other on the left side of that lower tip, normal multifidus function should engage when you pull your lower tummy, that's under your belly button, in towards your spine. You should feel that multifidus bulge on both sides. You may feel on one spot of the 5 different knobs or bones in your lower back where that multifidus does not bulge as much, indicating that it is either weak, it is atrophied, or perhaps the timing is dysfunctional. And many times when we also have a weak glute max, which makes the other lower back muscles like the erector spinae and hamstrings work harder because that's weak, that glute max is going to be associated with a delayed timing of the multifidus, and between the two of them, weak glute max and delayed multifidus, the complex is going to put a lot more biomechanical strain on our lower back than should be there. So learning how to engage these two muscles correctly together to work in concert to help stabilize your lower back is essential, and that's what this exercise is designed to do. We'll begin by using a split stance where we put one leg forward and one leg back. Now in this position, what we're going to practice is simply shifting our weight as if we're taking a step forward and allowing our pelvis to move forward over our foot. Make sure that you want to move both your pelvis and your sternum at the same time. If you have sway back posture, we've discussed that in a separate video, and you lead with your hips, you may not feel the correct muscular coordination. So you want to make sure that your sternum of your chest and your pelvis moves forward at the same time as you move that weight over the front foot. We're going to feel with our fingers that area where perhaps we did not feel that multifidus contract as hard, where the bulge did not come out when we pulled our lower abdomen in, or where we perhaps feel a hollow on the lower outer corner of those bones, indicating an atrophy, meaning the multifidus, because of chronic lower back pain, neurological compromise, has actually shrunk and it's shriveled and it's not as large or as full in its conditioning as it should be. So as we monitor that area, and we keep our weight on our back foot, we're going to move forward with our pelvis and sternum at the same time and see if we can get that multifidus muscle to contract when our heel first starts to leave the ground. If our heel doesn't leave the ground, one of the reasons that the multifidus may not contract when the foot leaves the ground is because of a weak buttock on that back leg. And you'll notice this if you take your other hand, whichever one is not feeling that multifidus, place it on your buttock and your lower back about an inch away from your spine. I've split my fingers, so one finger is about an inch away from my spine. That's called the longissimus muscle, part of the erector spinae complex, and my other fingers are on the buttock muscle. As I transfer weight, if I feel that lower back muscle, not the multifidus, but an inch out to the side of the spine, tighten and not the buttock as much, it indicates a weak buttock muscle, and that's one of the primary reasons why that multifidus is delayed and you're not feeling the firing effect or the contraction effect. So to correct this, we're going to emphasize a little tail under tension. Now tail under is the same as pubic bone up. That engages our abdominal muscles, and again, you don't have to actually move the tail under because that may change your curve in your lower back and disturb your neutral spine. That's a separate video. We talk about how to find your neutral spine based on your posture and your unique mechanics based on an analysis of your body. If you haven't done so, you may want to go to either the Posture Size or painfreeandfit.com website. We have a free body analysis there that teaches you how to analyze your lower back mechanics to know what direction you need to go in with your healing exercises. But for the purpose of this exercise, we're just going to tense the tail under as if we're trying to raise the pubic bone up or tuck the tail under our legs. That's going to increase our abdominal muscle and inhibit or relax that long erector spinae, the longissimus muscle. Remember, we haven't lost our contact on our multifidus that's weak with our other hand. And as we keep that tail under tension, we're going to purposely squeeze the buttock while the heel is still down and then keep the buttock tight as we move forward. Now, all of a sudden, with your buttock more tight, because your erector spinae, the longissimus, has relaxed, you can better localize the buttock. You can now feel the multifidus, or should start to fire more strongly as you go forward. So again, that's tail under, buttock tension, hold the buttock tension, shift your weight, pelvis and sternum at the same time, keeping the buttock tight. And now that weak multifidus that wasn't firing before, many times will start to fire, start to work, and you'll start to have a coordinated effect between buttock and multifidus. You can practice that right and left sides, one leg forward and then the other, and try to maintain that multifidus contraction both as you're squeezing moving forward and as you go backwards, back and forth. Maintain that tension of buttock and multifidus. Great way to train those two. Increasing repetitions. Remember, these muscles are stabilizing effects. So we want to train the type 1 aspect of these muscles, or endurance fibers, meaning we want to do high repetitions. We don't need a lot of weight or resistance. We just want to practice and build up the amount of time that we do it in, or the number of repetitions that we do over time. That's going to act as a nice healing effect or a healing stimulus for your body's repair mechanism and help to stabilize your lower back, get the correct mechanical movements in the muscles, and reduce the mechanical strain on your lower back pain. If you like this video and would like to learn more about healing exercises, feel free to subscribe to our channel. We got a lot of great videos on low back exercise programs. If you'd like to help me share this vital information with others, give me a thumbs up below. Any questions or comments, I'll be delighted to get back to you. If you're interested in learning a personalized healing exercise program for your lower back pain, go to the painfreeandfit.com website. We got a lot of great programs there that can help degenerative disc disease, spondylolisthesis, general low back pain, or if you have a combination of them all, there's a program there that's going to teach you analysis, how to analyze your body, your specific pain relief exercises that you'll probably require, strengthening exercises, conditioning exercises, stability exercises, how to find your neutral spine. All of those programs wrap that up and allow you to learn for your unique condition what exercise program and how you should approach rehabbing your own lower back mechanics and posture and stability. If you'd like a personal consultation with me, feel free to contact me. You can go to the painfreeandfit.com website. There are a bunch of different avenues you and I can get together to discuss your case. I hope that this exercise on integrating gluteal function and multifidus function helps to stabilize your lower back and helps prevent your lower back pain.